There's a lot of optimism around in Australia right now with plans to open up COVID-affected states. But there's been another reminder this morning of the infectiousness of this disease and the challenges we still face. Victoria has just recorded the highest new daily case number for any Australian state or territory through this pandemic. There was a big jump 5 days ago of nearly 500 cases on the previous day, and that was put down largely to parties and gatherings over the grand final weekend. And there was a hope that it might not leap far beyond that, but there's been another jump this morning of around 400 cases on the previous day, edging up towards 1,800 new cases in a single day. Reporter Leanne Wong joins us now from Melbourne. Leanne, so take us through these figures that have just come through in the last half hour or so.
Yeah, look, Joe, my heart certainly did sink when I saw today's numbers. 1,763 new local infections, and as you mentioned, the highest record of any Australian state or territory since the start of the pandemic. And also quite a spike from our previous high, which was just on Saturday, which is almost 1,500 cases. Now, sadly, another 4 more Victorians have died due to the virus, taking our total death toll linked to this current outbreak to 57. And it's also the 6th straight day where we've recorded more than 1,000 cases. And overall, there are more than 14,000 active cases across the state. And with that sheer number of cases just spreading right across metropolitan Melbourne and regional Victoria, well, yesterday the government flagged that it's going to stop progressively listing all our Tier 2 exposure sites. The Chief Health Officer, Brett Sutton, said that there was simply just too many sites, that Victorians wouldn't go through all of the list, and it's simply not an effective use of resources, and that the contact tracing system is under a considerable amount of strain. However, he did say yesterday that numbers in Melbourne's northern suburbs, where we've previously seen a lot of infections, have started to stabilise, and he attributed that to rising vaccination numbers. So hopefully we'll start to see that happen in the future. Maybe we'll see Victoria's peak arrive soon. So far, more than 52% of eligible Victorians have been fully vaccinated.
Yeah, I guess, Leanne, for some people it's not a complete surprise that this number has come through this morning, because the other day when it jumped up to 1,450 or so after the grand final weekend in cases there was a stark figure in on that day that they said 6 out of 10 of those new cases had come from totally new households. So inevitably there was going to be a bit of spread through those households.
Yeah, that's exactly right. So in previous outbreaks, we've seen a lot of transmission in workplaces. This outbreak, a lot of them have been mainly down to small illegal household gatherings. So a lot of it was attributed to the AFL Grand Final, as you mentioned, but also just in general, I think a lack of compliance. I think it's been, as we mentioned yesterday, the longest lockdown in the world, and there's certainly a bit of COVID fatigue in Victoria starting to creep in.
And Leanne, over the last several days when there have been these elevated numbers in Victoria compared to previous days, has it generally been the case that Daniel Andrews seems to be sticking to that October 26th day when freedoms will start happening? Even though there's this increase, he's pretty determined that the lockdown will start easing later this month?
He has been asked multiple times at our daily press conferences whether or not our roadmap would change in light of these numbers. And each time he's said it's simply too early to say that. He didn't rule out, however, amending the roadmap if these cases really do spiral out of control. Right now, as far as that we're aware of, the exit for our lockdown is still around October 26th, because we are on track or even ahead of schedule in reaching that 70% fully vaccinated target. But certainly that question, I'm sure, will be raised today at today's press conference.
And Leanne, you're standing at a construction site there. Just go back through what's happened with the construction industry as part of this outbreak in Victoria over the past month or so, and what's happening with that today.
That's right. So many people will remember that Victoria's construction industry was shut down for 2 weeks, and the government attributed that generally to a lack of compliance with COVID restrictions. They said that of all the sites that they'd inspected, about 73% were not complying with the Chief Health Officer's directives. However, from today, construction sites in Victoria have been allowed to reopen, though at only 25% capacity. However, major infrastructure works, like the one behind me, this will be allowed to reopen at 100%. All workers will also need to have at least one one dose of the vaccine before they arrive on site, and they'll also need to be fully vaccinated by November the 13th. Now, as you also remember, there was some discontent from several tradies within the industry, particularly about the vaccination mandate, and that eventually sparked a series of quite violent protests that we saw centred around the CFMEU headquarters as well as across Melbourne's CBD, and that was about 2 weeks ago. Now, since then, the protests did basically sort of trail off, and the union has said that a lot of those people who were in the protests were not representative of the industry. Many of them, they say, were not, in fact, tradesmen, that many of them were far-right agitators. And so certainly today, I'm sure there are many construction workers who are glad to be back in work today.
And Leanne, just finally, and on one other COVID-related issue, what's happening in the courts?
So this is fairly interesting. Belinda Setner, she's a casual relief teacher, and she's taking the Victorian government to court today over its no jab, no work policy. She says that it's a breach of her human rights and that it's not legally or ethically justified. Now, almost a fortnight ago, the Victorian government mandated vaccines for all workers across schools as well as early childhood centres. It was one of the earliest industries, in fact, to be hit by a vaccine mandate just after the construction industry. And then we did see that mandate widen last week to all authorised workers. Well, Miss Setner, she's also representing herself in court. She says that the mandate is discriminatory, and she's applying for an urgent injunction to essentially stop the Victorian government from being able to impose mandatory vaccinations on teachers. She's listed a number of health officials as plaintiffs in her suit, including our Chief Health Officer, as well as the entire state of Victoria. And that's set to go to be heard in Victoria's Supreme Court. Well, an administrative hearing will be heard in Victoria's Supreme Court in the next hour and a half. So we'll certainly be keeping a close eye on those developments.
Okay, Leanne Wong reporting there from Melbourne. And taking into account that relatively big number of new cases in Victoria today, there will be a lot of interest in the Victorian COVID update, usually held in that 11 o'clock hour Eastern Daylight Time. We'll bring you that live here on the ABC News channel, or you'll be able to see it on the main channel in Victoria, the main ABC channel in Victoria. So we've got the New South Wales political situation evolving as well with the New South Wales Premier today. We'll be right across that, but we'll keep you across all that information in relation to what's happening with COVID as well across the country. Now let's head to New South Wales. Regional areas across New South Wales are continuing to go in and out of lockdown. The Gunnedah local government area went into lockdown at midnight last night for a week because of recent transmissions. To our reporter in a moment, but first a quick look at the figures in New South Wales. We don't have this morning's figures through just yet, but yesterday New South Wales recorded 623 new locally acquired cases and the deaths of 6 people. In terms of the daily case numbers, that was another drop from Sunday's 667 cases, with the 7-day average now at 805. Cases are expected to rise again when the first stage of reopening begins on Monday. And the goal, and taking a look at the vaccination rates as well in New South Wales. So the state is on track to hit the goal of 70% of the eligible population fully vaccinated before the end of the week, just 2.5% to go. Currently 67% have had the 2 doses, and 88% of the eligible population have received their first dose. Reporter Manaz Anguri joins us now from City. Manaz, g'day. So what's the situation in the regions?
Good morning, Joe. So mixed news for regions in New South Wales. Some are going back into lockdown. So places like Forster, Tuncurry and Gunnedah have gone back into lockdown overnight. Muswellbrook's lockdown has also been extended. So they're all now subject to stay-at-home orders, which means they can't leave the house unless it's for essential reasons or for medical care. Now, on the other side, Cowra and Port Macquarie have actually come out of lockdown. So some good news for residents there who are not stuck at home anymore. So some mixed news for people around regional New South Wales, but some extra precautions now being put in place for certain areas as we reach that 11th of October target.
And so despite that mixed news, does it seem like New South Wales is on track to open up next week on that first Monday after the state reaches the 70% flu vaccine, about 16 across population?
Yeah, so we did record our lowest case numbers yesterday, 623 locally acquired cases. That's the lowest we've seen since August. Our vaccination rates, as you mentioned, are also going extremely well. More than 88% have received their first dose and more than 67% are now fully vaccinated. We are on track to reach that 70% fully vaccinated milestone in the coming days as we approach 11th of October next Monday, when we will enter stage 1 of New South Wales roadmap out of lockdown, which will see a number of restrictions across the state be eased, whether that's visitors inside the home, outdoor gatherings, or retail and hospitality opening up again, just to name a few. So a lot to look forward to for residents in New South Wales, even though there is some sombre news on other areas.
Okay, Mana Zanguru reporting there from Sydney. And we'll bring you that media conference if there is one from New South Wales, although there's a lot going on with politics in New South Wales this morning as well. But we'll bring those numbers will come through for New South Wales as usual around 11 o'clock Eastern Daylight Time, and we'll be right across them through the day. In South Australia, restrictions have been brought in for the Mount Gambier, Wattle Range and District Council of Grant areas for at least a week. Authorities are investigating the movements of a woman who tested positive on Sunday. Reporter Charles Bryce joins us now from Adelaide. Charles, good day. So what can you tell us about this woman's movements?
Well, Joe, that's really that's a question on everyone's lips at the moment. It's exactly what authorities are trying to work out. This woman, who is in her 40s, she was flown to the Royal Adelaide Hospital from Mount Gambier. She was quite unwell, but has since been released. She's now in the COVID hotel behind me with her 4 kids. She had originally told police that she was visiting family in Launceston, which is in Western Victoria, and is within that original border bubble with South Australia and Victoria. But Chief Health Officer Nicola Spurrier, she said yesterday that she could no longer confirm whether or not this woman had in fact been in Launceston. The Mount Gambier woman, though, she has now started to provide a bit more information on her movements, and people have been coming forward to authorities to say that they have potentially come into contact with this woman in different locations. Professor Spurrier, she was on ABC Radio earlier this morning. She said that there have been no new cases in relation to this Mount Gambier woman, and that 12 of her close contacts have since tested negative. Police Commissioner Grant Stevens, he has confirmed that they will be continuing to investigate this woman's movements and will be looking at whether she had been to Melbourne, but it's no doubt causing quite a bit of anxiety for the locals in Launceston and throughout the southeast of South Australia.
And what are the new restrictions across that region?
Yeah, well, these new restrictions have taken immediate effect. They have come into place for the Mount Gambier, the Wattle Range and the Grant regions. The private functions will be restricted to just 10 people. Density limits are being reduced to 25% capacity, and visitors, you'll only be able to have 2 visitors at your house. The Mayor of Mount Gambier, Lynette Martin, she said that while locals are feeling a bit anxious and a bit on edge, she's confident that the people will band together and get through these pretty uncertain times. Okay,
Charles Bryce reporting there from Adelaide. Let's head southeast to Tassie now. Launceston residents are being urged to get tested after a COVID-positive teenager breached home quarantine. The 15-year-old, who arrived from Victoria on Friday, visited a supermarket on Saturday while infectious and without a mask. Contact tracers found he also had at least 2 visitors to his family home while quarantining. The Prime Minister has accused the Queensland Premier of trying to extort money from the federal government. Several states and territories are urging the Commonwealth to provide more support for public hospitals to deal with COVID cases. Political reporter Jade McMillan joins us now from Parliament House in Canberra. Jade, g'day. So, yeah, pretty strong language from Scott Morrison, huh?
Yeah, good morning, Joe. The Prime Minister has rejected calls coming from a number of states and territories for more public hospital funding. They argue that that is needed so that hospitals can cope with an expected increase in COVID-19 cases as Australia starts to reopen. And the Queensland Premier, Anastasia Palaszczuk, had suggested that she might need to keep border restrictions in place unless there was a big injection of federal government funds. That has prompted the Prime Minister, Scott Morrison, Morrison this morning to accuse her of trying to hold the federal government to ransom, of trying to extort funding. And he says that if Queensland needs more money for public hospitals, then it should borrow that money. Now, the Health Minister, Greg Hunt, didn't go quite that far this morning, but here's what he had to say when he was asked whether the Commonwealth would step in with more support.
We have, in the case of Queensland, increased our funding by 99%, so almost double. Queensland has increased it by 55%. There's been 20 months for every state and territory to prepare, and Queensland has said that they are prepared for COVID. I would be encouraging Queensland to match the Commonwealth funding increase. There's no barrier to that, and I would be very concerned if somebody were using a play for funding to separate families. This has to be about science and medical protection.
Greg Hunt there speaking just in the last hour or two. And Jade, has there been any reaction to those comments from the federal government?
Well, we haven't heard from the Queensland Premier yet in response to those comments from the Prime Minister, Scott Morrison, but the Federal Labor Party has weighed in. Frontbencher Bill Shorten has argued that the Commonwealth should do more here when it comes to public hospital funding.
Hospitals need more support. It's a fact of life. And the federal government, in my opinion, has been a delinquent partner in properly funding hospitals. So they need to negotiate with the states a better system for funding of hospitals. But we're here in the situation now with COVID, and I don't think it's enough for the government to say, oh, that's not our problem.
Labor's Bill Shorten there. So, Joe, another spat between the federal government and the Queensland government, but given that this issue of public hospital funding is one that a number of other states and territories are concerned about, we can expect this to develop further.
OK, Jade McMillan there in Canberra.